Good afternoon, everybody. Welcome to our Heart Health Lecture Series. I hope you had a good summer. We're very excited about the programs that are coming up. And we are very, very excited about our speaker tonight, who I'll introduce shortly. My name is Dr. Dennis Goodman. I'm a clinical professor in the Department of Cardiology and Preventative Medicine, and I'm Director of Integrative Medicine at NYU. And it's been a real pleasure to put this series on with my partner is Anya. So I always want to give a shout out to say thank you so much, Anya, for what you do to make all this happen. So a little bit of logistics, how to ask a question during the talk. If you just go to the Q&A box, you can type in a question and we try to get to as many questions as possible. I've already received many questions by email and we'll try to get to as many as we can. I'm sure many of them will be answered by Dr. Katz during his talk. So our next lecture is on Tuesday, November 15th, and it's how to grocery shop for heart health with one of our favorite speakers, Melissa Al-Azraqi, and we look forward to seeing you there. To register, if you go back one, this is the website, which I'll mention in a minute, nyulangone.org/heart health lectures. You can register and find out a lot of information about our programs. Next slide. So we've been doing this since 2015. We've had over 50 lectures at this point. We focus on prevention. And as you can see, many of these topics we visited not once, but several times, because we're very focused on trying to get people to be healthy, prevent illness. It turns out that 80% of strokes and heart attacks are preventable with lifestyle changes and taking good care of yourself. And you're going to hear tonight that when it comes to COVID, it's the same story. Next slide. So we have a lecture library now. We're very excited about this. Many of our lectures have been recorded, and this one's being recorded. We've now got 27 videos on YouTube, and we've had over 78,000 views of these lecture series. So it just shows you how popular this is and how many people are benefiting from around the country and probably around the world. Next slide. So how do you keep in touch with us? This is the website. I'll mention it again in a minute. You can get to us on email and Twitter. Next slide. You can take a picture of this if you've got your cameras. Otherwise, you could write this down. nyulangone.org/heart health lectures. And this is where you can register. This is where you can find our YouTube videos, and you can find out what we're doing in our prevention series. Next slide. It's my great pleasure tonight to welcome Professor Stuart Katz, who is a colleague and a friend. And we are very, very honored to have him speak tonight. He is one of our rock star cardiologists, researchers at NYU, and he's the Helen L. and Martin S. Kimmel Professor of Advanced Cardiac Therapeutics and contact PI for the Recover Clinical Science Core at New York University Langone Health. You're going to hear all about the Recover program. It's an incredible program, which is headed by Dr. Katz. The NIH has invested about $500 million into this particular research program, which extends to many sites across the country. And we will hear something about that tonight. Dr. Katz is also chair of NYU Grossman School of Medicine IRB board and chair of the NYU CTSI, Expanded Scientific Review Committee. CTSI is Clinical and Translational Science Institute. Dr. Katz's academic pursuits have been devoted to clinical care and research in cardiovascular diseases for over 3 decades. Dr. Katz has authored more than 200 original research contributions, review articles, books, and book chapters on heart failure, vascular physiology, exercise physiology, and clinical encephalology. He's a world expert on advanced heart failure, and he is one of our most popular cardiologists and physicians because he's always willing to teach and be helpful. So Dr. Katz, I'm honored to have you on our series. Thank you very much for joining us, and we look forward to your talk.
Dr. Goodman, thanks so much for inviting me. It's really exciting to be a part of this series. And again, as a heart failure physician, I don't get a chance to be parts of prevention series very often. So it's really a very welcome opportunity for me today. And today we will be talking about long COVID and the heart. So we could have the next slide. And so I thought about what are the questions that we'd want to talk about for long COVID in the heart. And the first is just simply, what is long COVID? And I'll take some time going through that with you. Then how is COVID related to the heart? Does infection with COVID-19 increase risk of heart disease, including heart attack and stroke? And finally, is it safe for cardiac patients to take the COVID-19 vaccine? Next slide. So we'll touch on all those points. So I'm starting off with a slide that sort of looks complicated, but I'll take you through it. And the point of the slide is understand that there are both short-term and also long-term phases of the infection with this SARS-CoV-2 virus. And the SARS-CoV-2 virus is the novel virus, meaning it became known to the world only recently in early 2020. It's a coronavirus, and it is the cause of what we now call COVID-19. And the acute phase of COVID-19 is shown in the sort of bluish hues on the slide. And this is a timeline. So the COVID virus, when someone gets infected with that virus, there's actually an asymptomatic phase before people are aware that they're sick. And this is why the virus can spread in asymptomatic people. Once people start to get symptoms, and the most common symptoms of the acute infection, COVID-19, are fever, cough, body aches, headaches, loss of smell. And that's when the tests for COVID are positive. So early on, if you test from a nose swab or elsewhere in the respiratory tract, there'll be evidence of the COVID virus in somebody's body. And over a period of a few weeks to up to 30 days, the symptoms get better over time, and those tests of the virus generally turn back to negative for most people. And for most people, they recover from that acute illness, and they don't have any lingering symptoms. But soon after the pandemic started in early 2020, it became recognized that there was really a substantial number of people who had the acute COVID-19 and then started to have lingering symptoms that lasted a much longer period of time. And it was a whole variety of different symptoms that are shown on the slide here. And this is looking at sort of the pinker hues to the slide. And so there were people who were having trouble with severe fatigue and sleep disturbance, people for whom the cough never went away and they were, out of breath or even had low oxygen in the blood and needed to have supplemental oxygen for long periods of time. There were people talking about problems with their concentration, brain fog, difficulties with anxiety and depression, cardiac symptoms, including palpitations and chest pain, and also evidence of blood clots forming that could cause blood clots going to the lungs or even traveling to the hearts, increased risk of other chronic diseases like kidney disease, new onset of diabetes, and then, sort of strange things that people were reporting, including losing hair and losing teeth. And all these things were accumulating in medical literature and in reports until it took about 6 months before people started to recognize that there was a long-term effect of this SARS-CoV-2 infection. And this is what was coined long COVID. And the official definition is usually taken if the symptoms extend beyond 4 weeks. And most people who get these symptoms, these symptoms tend to get better over a period of time. And most people, the symptoms are gone after 6 months. But there's a group of people that have had symptoms really for much longer periods of time, really going back to the very beginning of the pandemic. There's people who have been seriously ill since March of 2020. And that is, so there's this very broad spectrum of what we call long COVID, both from the standpoint of the types of symptoms and also the duration of the symptoms. Next slide. So in order to understand this long COVID and why it has so many different symptoms, I wanted to take just a little bit of time to review what's special about this coronavirus SARS-CoV-2. And one of the things that distinguishes it from other viruses is how it actually infects our bodies. How does it actually get into the cells and make us sick? And the SARS-CoV-2 virus uses a receptor that's normally present on many of the cells in our body called the ACE2 receptor. Now, some people in the audience may know that they're taking ACE inhibitors as a medicine. It's a commonly used medicine that's used to treat high blood pressure and reduce risk of heart attacks and strokes. And this virus is taking advantage of a related receptor that's in our bodies. So the ACE2 receptor is sort of a distant cousin of the angiotensin converting enzyme. And so the virus attaches through the spike protein to this ACE2 receptor, and then is taken inside the cell. And like many viruses, these viruses actually use our own cells against us. So once the virus is inside the cell, it actually uses the cell components that are naturally there and doing good work to keep ourselves healthy, and instead turns it into a factory to make more viruses. And then the viruses are able to exit the cell and then in turn infect other cells. So this is how, a single SARS-CoV-2 virus, once it gets into the system, can generate large numbers of viruses that lead to the clinical illness. Next slide. So the reason I took the time to tell you about this ACE2 receptor is that it turns out that the ACE2 receptor is located in all the major organs of our bodies. So SARS-CoV-2, by taking advantage of this ACE2 receptor, can infect many organs in our body. And this is, this slide is just showing that the ACE2 receptor is in the heart, it's in the lungs, it's in the pancreas, it's in the kidney, it's in our gastrointestinal tract, it's in blood vessels, which of course means that it's everywhere through our body, because every single part of our body has blood vessels that deliver blood to deliver oxygen and take away the carbon dioxide and other products of metabolism. It's in the liver, and so on, and the brain, so on and so forth. So because the ACE2 receptor is so widespread within our bodies, this may explain why the illness associated with SARS-CoV-2 could be causing so many different symptoms in so many different organs. Next slide. So the question is, why does the acute COVID-19 infection turn into this long COVID syndrome in some of the people? So again, not everybody gets long COVID. It's a subset of people. And there's a few theories that are quickly summarized on the slide. One is that the virus never gets completely cleared from our bodies, and that there's certain reservoirs in the body where the virus persists. And for some reason, our immune system can't completely get rid of it. And one of the leading candidates for this is thought to be in the GI tract. And this is why you may be hearing in certain news reports that public health services are now looking at wastewater to figure out what's going on with COVID infections. And that's because, in part, the COVID is in the GI tract and is excreted and into wastewater. Another leading theory is that the viral persistence triggers changes in our immune system. so that the cells that we rely on to fight infection are altered in ways that make them less effective. So that could be the T cells, which is a kind of white blood cell that usually fights viral infection. There's also another type of white cell called macrophages, which become less effective. And then finally, there's our bodies are regulated by these inflammation signaling proteins called cytokines. And there's a very fine balance between cytokines that are pro-inflammatory and cytokines that are anti-inflammatory, and they have to stay in balance. And the thought is that sometimes some viruses or other health conditions are associated with imbalance between these cytokines, and that can affect the organ function, make people not feel well. And then finally, this virus could either through its own structure, the fact that it actually is interacting with the ACE2 receptor, or because it actually causes damage, can trigger an autoimmunity situation. And that's where the body's immune system actually starts attacking our own body organs. So it's like a secondary consequence of the infection. There's damage to our bodies through autoimmunity. And there's lots of research being done to explore these different mechanisms, because these mechanisms may be the key to finding specific treatments for long COVID in the future. Next slide. So I took this slide from a review article, on purpose, because it's showing how complicated long COVID is. I just want to, the way it's set up is that the different kinds of symptoms are grouped by color, and the size of the circle tells us how frequent the symptoms are. So a couple of just highlights from the figure. First is that in this series, 80% of the people had reported at least one symptom. And the most common symptom, the biggest circle on the slide, is fatigue. But other common big circles on the slide, include headache, hair loss, loss of taste and smell, coughing, being out of breath, chest pain, and so on and so forth. So there's really a myriad of symptoms that are being reported by people that are associated with long COVID, and it's really quite different for people. But it's also important to point out that some of the symptoms seem to cluster together. So some people seem to have more symptoms that are related to the way they're feeling and the way they're thinking. So sort of neurologic symptoms. Other people have symptoms that are more grouped around the way they're breathing, feeling out of breath or having heart symptoms and chest pain. So it does seem like there's certain groups of symptoms that seem to cluster together, but we don't understand why some people have certain symptoms in groups more than others. So I think the key takeaway points from this slide is that there's been potential involvement of long COVID with essentially every organ system in the body. It's also important to point out that many, or in fact, almost all of the symptoms are really common symptoms that people experience in everyday life. So people get colds, people get the flu, they get cough and shortness of breath and other symptoms related to things that are not COVID. So it's really just recognizing that these symptoms can occur in somebody who's had COVID, that really, and that they occur in certain patterns that helps doctors figure out who actually has long COVID. But it also means it's complicated, and there's no single blood test that can tell us who has long COVID versus who has asthma, who has long COVID versus who has some kind of heart disease. So it's really, doctors have to be very aware of the long COVID symptoms and try to piece it together to see is the person really suffering from long COVID. And even though in this series, 80% of the people reported symptoms, the best estimates that we have of long COVID right now are that it's really in about a third of the people. 1 of 3 people who have had the acute COVID wind up developing the long COVID. And we know that one of the risk factors for developing long COVID that's been very consistently reported is the severity of the acute COVID-19. So people who have more severe acute COVID-19 are the ones that are more likely to develop long COVID. Next slide. And another important point is that the long COVID symptoms can change over time, even in the same individual. And this is really just a schematic, a thought slide to show how that can happen over time. So if you can hit next, I'll just show that we have time one. Yeah, so somebody early after their COVID infection could have symptoms that most prominently are related to the central nervous systems. This could be difficulty concentration, anxiety, depression, maybe loss of smell, and other symptoms related to the heart and lungs and fatigue may be less prominent. But then a few months later, if you hit next again, at time two, the situation can reverse, that the neurologic symptoms get much better and that the cardiac and lung symptoms are getting worse over time. So everybody has their own story of long COVID, and doctors, have to be trained to be able to listen and understand what symptoms are, people are experiencing over time, and that's going to help them best relieve those symptoms. So next slide, please. So now just to take a few slides to focus on specifically on COVID and long COVID on the heart. And this slide is summarizing some of the different pathways that are related to the heart and that are known to be associated with long COVID. So first is blood clots and damage to the blood vessels, specifically arteries and small arteries. We know this can be associated with damage to the heart through what's called sort of micro emboli, and so it can cause small areas of damage to the heart. It's a little bit different than the typical blood clots that can cause heart attacks and strokes, because those tend to form in larger arteries. So these are smaller, but can still lead to damage of the heart. There's also evidence that the COVID-19 virus can directly affect the heart and also the pericardium, which is a sac that is around the heart. And if the heart or the pericardium become inflamed or damaged, it can also lead to symptoms. And finally, we know that the COVID virus can affect nerves in the body, and the heart is controlled by a nervous system called the autonomic nervous system. And the autonomic nervous system is the part of the nervous system that controls many of the bodily functions that we don't think about. So if we don't think about how our heart rate might get bigger, faster when we exercise, slow down when we rest, or that our breathing will get faster when we exercise and slow down while we rest, or how food passes through our gastrointestinal tract, or how our bladder knows when it's time to be emptied. But the autonomic nerves are really in charge of all those bodily functions. So obviously, very, very important. And so the symptoms related to COVID in the heart are summarized here, and they include chest pain, dyspnea, which is shortness of breath, palpitations, and particularly the heart racing with just standing or with minimal exertion. So people say that they just walk across the room and their heart is racing, and so in a very abnormal way. And finally, fatigue. And people, as I pointed out, fatigue is the most common reported symptom in long COVID. Next slide. So the specific types of diseases that are associated with long COVID, and there's different lines of evidence that point towards this, and I'm not going to go through this all in general, but it basically impacts many types of cardiovascular disease, including heart attack and stroke, myocarditis and pericarditis. This is inflammation of the heart muscle or the sac around the heart, and this can be quite problematic. There can be heart rhythm problems, increased risk for abnormal heart rhythms associated with long COVID. And finally, this on the right, this is an abbreviation. It's called the POTS syndrome. And I won't go through exactly what it stands for, but this is related to those autonomic nerves. So when the autonomic nerves are not working right, people can get palpitations, to have their heart racing when it really shouldn't be. So all these have been associated with the COVID infection and long COVID. Next slide. So of course the question is, what can be done about it? And really, the best way to prevent long COVID is to not be infected with COVID. So taking all the smart precautions to avoid situations where there's greater risk of being exposed to COVID are really important. And the next, defense in terms of prevention is not to get severe COVID. And so how do you not get severe COVID? Well, that's by taking good care of yourself, by heart healthy lifestyle, using the medications to control cardiac risk factors. Those are all things that are known to reduce the risk of severe COVID-19. So there are no known treatments for long COVID right now, but there are treatments available for the cardiac manifestations of COVID. So if somebody has a heart attack or stroke, obviously they can be treated. If somebody has heart rhythm abnormalities, obviously they can be treated. But the best way to avoid these cardiac manifestations is to avoid COVID, or at least reduce the risk of severe COVID. Next slide. And of course, the other component to reduce the risk of severe COVID is related to the COVID vaccine, which is safe and effective. It's particularly effective for reducing severe COVID and hospitalizations for COVID. And this is, there are some rare cardiac effects of the COVID vaccine. This slide is trying to put that in perspective. And so I want to make 2 points. This is looking at 1 million male individuals aged 12 to 29 years of age. And the reason they picked male individuals in that age range is that that's the group that's known to be at the greatest risk for cardiac effects of the COVID vaccine. But out of those million young men in this in these studies, less than 50 would actually have those manifestations. So it's a very small risk, but it's there. But at the same time, that in those same million individuals, 10-fold more people would be helped by fewer hospitalizations, fewer ICU admissions, and fewer deaths, even in young people. So what I would say is that thinking about the risk of the COVID vaccine in older individuals, where the risk of these side effects of the vaccine are actually much less, and the benefits of the vaccine are actually much, much more, it's really an open and shut case that the COVID vaccine is safe and reduces the risk of severe COVID, and therefore the evidence so far is that it also reduces the risk of long COVID. Next slide. So how can we learn more about long COVID? As I pointed out at the beginning, the SARS-CoV-2 virus is a new virus discovered 2 years ago, and we still don't know everything we need to know about it. So as Dr. Goodman mentioned, NYU was selected to be the clinical science core leadership for a very important study, which is called RECOVER. It's been on the bottom left corner of all the slides here, and RECOVER is an acronym for Researching COVID to Enhance Recovery. So it's really a large study that's devoted to better understanding long COVID. Next slide. And so what are the goals of RECOVER? We started this study about 1.5 years ago, and it's to improve our understanding of and ability to predict, treat, and prevent long COVID. And our key scientific aims are to understand the causes of long COVID. We know it doesn't affect everyone, And we know that people have various ways, that they recover over time. So we're trying to understand why that's the case. We also want to define long COVID and try and develop blood tests so that we can really know who's at risk, who's actually has long COVID. As I pointed out, many of the symptoms are common symptoms. And so we want to get better at actually diagnosing long COVID. We also want to understand beyond the symptoms, whether COVID is actually affecting our bodies in a way that it's leading to other diseases. Is it increasing the risk of chronic kidney disease? Is it increasing the risk of heart disease? Is it increasing the risk of diabetes over time? So we're studying how often that's happening, and also trying to understand why that's happening. And finally, all this knowledge is specifically being gathered to help us identify interventions so that we can treat and prevent long COVID. Next slide. So this study is a large study funded by the National Institutes of Health. It's a nationwide study, so NYU is leading the study, but in concert with enrolling sites all over the country, all 50 states, including Alaska, Hawaii, and also Puerto Rico. We have sites in Puerto Rico, which unfortunately have been negatively impacted by the hurricane that just hit there. And so we have those people, in our thoughts and prayers. And it's enrolling 60,000 people across the lifespan. So adults, children, and their caregivers, pregnant participants, and also their newborn infants who are exposed to COVID during the mother's pregnancy. So we are enrolling hundreds of sites. We aim to match the same ethnic and racial diversity that we know has been impacted by COVID across the country. And we are going to enroll in all age groups and all geographic regions. And we're also involved in what we call real world data studies. So people who sign up for a study is only a subgroup of the population. So we're also collaborating with investigators who have access to over 30 million electronic health records. And this is both adult and pediatric electronic health records. And so we're using that information to help us understand what's happening to people in the real world. Next slide. So what is the RECOVER study about? What do people who join the study have to do? So it's called an observational longitudinal study, which means that there's no specific intervention, there's no treatment for COVID. We just asked people to join in visits over time, where we get them to answer questions about how they're feeling. We collect blood and other types of specimens that are stored in a biorepository so that we can understand in the future. We can run tests that can help us understand the causes of COVID. They get simple checkups, and a subgroup get more sophisticated studies. So there's different kinds of x-rays, CAT scans, MRIs, exercise tests, etc. And all this information is going to be made available to all scientists across the country, so that everybody can work together to figure out the causes of long COVID. Next slide. So again, if people want to take out their cameras, here's some of our contact information. Our website is recovercovid.org. It has lots of great information about the study, but also about long COVID in general. We've had our own webinar series that has videotapes there about long COVID. So it's really a great site, and I encourage you to visit. Next slide. And finally, I also want to point out that we have a great NYU Langone post-COVID care program, which is run by Dr. Ronnie Kondos. And this program is a multidisciplinary program that provides comprehensive evaluation and treatment for people experiencing long-term symptoms after COVID-19 infections. And the contact information is here, and you can search the post-COVID care program to see this information as well. Next slide. So long COVID in the heart, we started off with questions, and I hope that I answered the questions. And here are the key takeaway points. And so first is that some people will experience long-lasting symptoms after an acute SARS-CoV-2 infection. The most common symptoms are fatigue, headache, shortness of breath, palpitations, brain fog or difficulty concentrating, hair loss, and loss of smell. Long COVID can affect the heart and increase risk of heart attack and stroke, heart rhythm problems, heart failure, and inflammation of the heart. COVID-19 vaccinations are safe for the heart and may reduce the risk of long COVID. Next slide. So thank you for your attention this evening. It's been a pleasure to be here. Happy to take your questions.
Thank you, Stu. That was outstanding and an incredibly comprehensive review and well put so that people can understand. Obviously, it's a little depressing listening to it because, it's all about the potential for problems with having COVID. But I think it's important that people understand that this is, a virus that can affect, as you said, every part of our body. And I just want to make a plug for prevention, that the most important thing we can do, and it's not just COVID, is to take care of yourself with a healthy lifestyle. I often talk about the 4 legs of a stool, which are nutrition, exercise and flexibility, stress management, and sleep. And we often have lectures regarding all 4 of these topics, because if you can focus on these healthy lifestyle changes, you're much less likely to get many illnesses, many chronic illnesses, and certainly COVID is one of them. I've got several questions that have been emailed in, and maybe we can just run through some of them. But I want to thank you again for an outstanding presentation. So this is, I'm sure you have touched on some of these things, but people have asked, and I'm going to let you repeat if necessary. Should a person over 65 with a history of heart disease take extra precautions to avoid getting COVID-19?
Yeah, absolutely. Everybody's got to make personal decisions, and obviously in consultation with your physicians. But a person over 65 is clearly at greater risk for severe complications of COVID, and therefore at greater risk for long COVID. So I do think that it's that it is worthwhile. I would recommend that a person over age 65 should take those extra precautions.
Next one. What can I do to prevent or reverse COVID-related cardiac symptoms?
Yeah, so this, I did make the point that there is no specific treatment for long COVID, but there are strategies to reduce the symptoms, and some of the symptoms of long COVID are related to fatigue and actually sleep disturbance, and so there are therapies and including cardiac rehab therapies, but it's not the same. It's not the typical cardiac rehab. It's really things that are specially tuned to people that are having fatigue and post-exercise malaise, where exercise has to be very carefully and slowly introduced. But there are treatments. So I think if somebody is suffering from COVID-related cardiac symptoms, they should see their doctor and get referred to the people that can provide that symptomatic relief.
And I would just add to that, I mean, as you've said, many of these symptoms are non-specific and caused by many other conditions. So yes. If you had COVID and you then have a symptom like shortness of breath, don't assume that it's necessarily COVID. It may not be. And in 2/3 of the cases, it's not. So I think that it's important that you see your physician and he or she will figure out whether or not you have another cause for your symptom. And obviously in medicine, we always look at what are the causes, because the best way to treat things is try to treat the underlying cause. So I'll just make a case for don't make assumptions, see your physicians and let them try to figure out what's causing your symptom and how best to treat it. Next one. Do long COVID symptoms come and go in waves? I think that's interesting. I think you pointed out something very interesting, that you can seem to improve and then things get worse over several months. And does it become progressively worse, or can it get better and worse again and intermittently wax and wane?
It can be very much coming in waves. This is something that we hear from patients all the time. I mean, I'll mention that I actually had long COVID with symptoms lasting nearly a year after acute COVID infection in December of 2020, and I definitely experienced this since, where I was, you'd be feeling a little bit better. Oh, thank goodness, this is really starting to go away, and then it would just get worse again. And I've heard stories from patients where it like completely went away and then reappeared, maybe in a slightly different form, a month or 2 months later after really feeling well. So the answer is yes, it can come and go in waves, and this is another part of the symptoms that we really don't understand.
Okay. Are there ways of trying to reduce heart attack and stroke if a person gets COVID-19? And how is this impacted by age? And I guess that, comes to the question of, should you be on an anticoagulant? We measure something called the D-dimer, and we don't have good answers to this at this point, but I think it's really important to think about whether or not you need to be on something, and you can take it from there, Stu, and I think it depends on every single patient is different and the situation is different, but we are using anticoagulation in certain subsets of patients.
Yeah, absolutely. So there's definitely a subset of patients who have really just objective evidence of recurrent, blood clot events, and including, blood clots to the lungs, and other types of events where, again, even without completely understanding how long COVID is sort of associated with that, it makes sense that those people will benefit from blood thinning medications. So here, again, I think it's really coming back to that same message that you just delivered so well, which is that is that if you have a history of heart disease and you've had long COVID, particularly if you had more severe long COVID, you should be following up with your physicians to be evaluated for your ongoing risk of heart attack and stroke, and make sure you're getting all the treatments that are known to reduce that risk.
Are there any restrictions to getting the third COVID booster and maybe the fourth booster and the fifth booster? Are there any subsets of patients who shouldn't receive continued boosters?
Yeah, so the answer is, there are, somebody who's had certain types of severe reactions to a previous injection. There may be restriction about getting, but in general, that's exceedingly rare. So for most people, there are no specific restrictions for getting the third booster.
I'm glad you mentioned the vaccine story, because there are a lot of anti-vaxxers, and it's a real sad thing, in my opinion, because I think that we don't really have good evidence at all, or any good evidence that it's a risk when it comes to the risk-benefit ratio. There's a tiny risk, but the benefit is so much greater. And it's sad to me that a lot of people didn't take vaccines, especially early on with, the Alpha and Delta variants, and they could have possibly prevented severe illness and even death. So I just think the message that you've sent out is really important, that people should be vaccinated. And if you are eligible for the second or the third or fourth booster, that you should have them, especially if you're older and at risk.
Yeah, that's a really important message. I'll mention that I got sick a week before my vaccine was scheduled in December of 2020. As a heart transplant physician, we were prioritized to get the vaccine first, because we're working with patients who have their immune system suppressed. But I unfortunately got sick a week before, and I've had all my boosters since that time. So hoping never to have COVID or long COVID symptoms again.
So I think you touched on this syndrome. Are there any transient or permanent changes to one's autonomic nervous system, such as increased resting heart rate? You mentioned the POTS syndrome, which is postural orthostatic tachycardia syndrome. where the autonomic system can be affected. Are there any other autonomic nervous system, conditions that can happen? I mean, are there people who, more likely, and I think this is a possible cause for people who are dizzy, maybe they're not, the autonomic nervous system is somewhat damaged, and it may take a while for it to recover. But I think the question here is, clearly you answered it with regards to POTS syndrome, but any other conditions that you can think of?
Well, the other condition that's definitely been reported as part of long COVID is this, myalgic encephalitis chronic fatigue syndrome, which is thought to be also related, at least in part, to autonomic dysfunction. And this syndrome, which remains poorly understood and which has been described after other viral infections, including the original SARS virus from 20 years ago and the MERS virus a few years later, is also being described after this more recent SARS-CoV-2 virus. So that some of the people that experience this chronic fatigue syndrome really have debilitating symptoms that last years, and in fact there are reports of people from the original SARS outbreak that developed these symptoms in the early 2000s and are still sick 20 years later. So never returned to full functional capacity that they had before the illness. So this is obviously a very, very huge challenge, and we have been working with some of the advocacy groups to make sure that that within Recover we're making the measurements to try and understand how this virus relates to symptoms that people are experiencing after other viral infections or other types of infections.
Okay, thank you. Does COVID or long COVID affect heart valve regurgitation? In other words, is there any evidence it's affecting the heart valves? We know about the muscle, we know about the pericardium, about the coronary arteries, but
yeah, for this one, I'll just have to say that I'm not aware of any reports. I definitely would never say never for anything to do with COVID, because it has so many different manifestations. But I'm not aware of any specific heart valve regurgitation reports.
I guess it could be secondarily, if you end up having a myocarditis and heart failure and large ventricle,
right,
you could get it in that respect. I've got a question about the immune system. You mentioned, which is a very important point, that the immune system can be affected, then you're at increased risk for, future infections and even possibly malignancies. Is that? So I think it's important that we do everything we can when you have had COVID and you've got long-term COVID, to do everything you can to keep yourself as healthy as possible. And that goes back to the same lifestyle changes I mentioned for prevention. Are you testing the immune system in any of these patients in your trial?
Yeah, absolutely. We have really a great group of translational scientists working with us in Recover. These are from leading academic medical institutions across the country, and every single imaginable test on the immune system is being done, and our biorepository has tens of thousands of specimens. So we view this as a resource that will help us understand long COVID, possibly chronic fatigue syndrome for a long as a resource for many years, for things that we can't even imagine right now.
I think the real challenge is, once you find these things, what can we do about it? And that's why the study is so important, trying to find treatments. So just to end off, you mentioned this is how you contact the program. There's the website. If you're interested in getting a consultation, or if you think you may have long COVID, or you want your doctor to refer you to someone who's a specialist in this condition, Dr. Katz mentioned Ronnie Condas, and here's the phone number, 212-263-6115. or you could use the email postcovid@nyulangone.org. So Dr. Katz, thank you so much for that outstanding presentation. Really appreciate you speaking at our series. I thank everybody for joining us today. Don't forget to contact us at hearthealth@nyulangone.org. This lecture has been recorded and you will be able to listen to it again or to let your friends know about it. Thanks again, Stu.
All right. Thank you for inviting me.
Bye.